Recently, we've developed a new technique of sealing in the seal. We feel it's easier to use and provides better healing results. And don't you wish that all extractions were that easy? Here we have premixed the socket graft putty, and I'm expressing the excess air that's in the syringe so that the putty that goes into the socket doesn't have any air pockets in it. You can mix the socket graft putty up to an hour beforehand, but then it can be quite hard to express, although it is more firm. I like to mix it just before the extraction is complete so that it is fairly soft and easy to inject into the socket. I start at the apex of each root and fill each root with socket graft putty, and then I overfill the socket a few millimeters with socket graft putty to make sure that I can go back then and I can actually compress the putty into the socket to make sure I'm removing any air pockets out of the grafted site. Here I'm using a spatula just to compress the putty into the socket. You can't compact it, of course, because it's a putty and it's not hard like granules. And all you want to do is just make sure that there are no air pockets in the socket after you've grafted it. And I'm just continuing to clean up around the graft site to remove any of the graft material that might be over the margin and over the teeth. You don't have to clean it up really well at this point in time because after we place our seal, we'll do the final cleanup. Here is the unaltered socket seal. We're just doing a try-in at this point in time. I just lay it over the surface, get an idea of where I need to trim it to make sure it fits the socket well. And as you can see, I just slid it off the top rather than picked it up. If you slide it, you won't remove any graft material, but if you pick it up, the adhesion of the putty, because it is a biocement, may remove some of the graft material with your socket seal. Here I'm using a curved scissor to trim around the lingual um, area of the extraction socket. And after I do that quick trim, I'm going to go put the socket seal in place. Socket seal doesn't need to fit perfectly, but it's nice that it fits well and actually maybe a little larger than the socket, so it fills the socket completely, but it's not absolutely required with this technique. I'm using the 2x2 to clean the teeth, the gingiva of all the graft material, but also I'm compressing the buccal and lingual gingival margins to try to get out any graft material that might be lodged between the gingival margin and the socket seal. It's not critical. You can have a little bit of graft material in there because with this technique, we seal it all in and it seals very effectively. Here we have a pipette of a product called PeriAcryl. It's a cyanoacrylate designed for dental procedures, and you just drip it onto the margin between the gingival margin and the socket seal. I like the violet color so that I can actually see where the PeriAcryl has been applied. They also make clear PeriAcryl also. And I like this pipette because they're single-use pipettes, and you can just and there's plenty in this single-use pipette to complete your procedure. So I usually go in and apply it to the gingival margin, go around the periphery of the gingival margin, and I'll do this one quick time, and that stops any bleeding. You don't want to get the tip of the pipette actually into the blood because then it will begin to set and you'll sort of get stringy periacryl that you have to trim off. So I'll go in one time and then I'll wait a few seconds to make sure it's fully set. Once it's set, I'll go back and maybe do another application or two around the edges to make sure that I've got a really great seal. Once you've got the periacryl in place and everything is secured, the socket seal is fixed in place, then I like to put in a suture just for making sure the socket seal doesn't come out once the bond between the gingiva and the socket seal is released. And I go in through the top of the socket seal, out the buccal gingiva, bring the suture around, go in through the top of the socket seal, out the lingual gingiva, and then I just tie it. And this is just a retention suture. And also if you go through the buccal gingiva, come around, go through the lingual gingiva, you're tying on top of the seal, and you're not pulling the seal either to the buccal or the lingual like you might do with just one gingival margin. And in this way, it retains the seal, doesn't disturb the bond, and the seal can't come out after the bond is broken between the gingival margin and the seal. After I've sutured things in and everything is solid, I'll go in and trim off any excess periacryl from the adjacent teeth. Here you can see we're rinsing the final product. This is a close-up of the final product. If you have any strands of periacryl left after the application of the periacryl bonding agent, you can simply trim them off with the scissors. You can see the PeriAcryl is rimmed around the border and bonded to the gingiva. The PeriAcryl has really improved our technique. It's made it a lot easier to apply the socket seal. The bond is absolutely superior rather than just suturing. People are sucking on straws or cigarettes. They are unable to remove any of the graft material with that motion. Also, when you have people inadvertently eating in the area, the socket seal is not depressed into the socket, and we're getting a much better healing result. The socket seal is then removed in about a week because the bond between the seal and the gingival margin is released about that point in time. We also feel that using the socket seal produces a better healing result. When you remove the socket seal, you may see a fibrin clot, you may see immature connective tissue, but the graft is in place and the regenerative process is well underway at this point in time.